Hello and welcome to Docplexus News. The Indian Medical Association has recently stated that the proposed National Medical Commission Bill 2017 does not comply with the public interest. IMA stated that the centre's proposed NMC bill is evidently aiming at total centralization of power and authority and intends to make the regulator totally subservient. Lok Sabha recently passed a bill that bans commercial surrogacy and allows only close relatives to act as surrogates to needy couples. Mr. J.P. Nadda said that this bill protects women from exploitation and ensures the rights of the child born through surrogacy. The bill demanded a ban on commercial surrogacy, but altruistic surrogacy will be permitted for needy infertile couples. Dr. Neeraja Bhatla from AIIMS Delhi has successfully finished the trials of a pocket colposcope for the screening of cervical cancer. The device developed by Duke University costs about $500, whereas the currently used colposcope costs $15,000. The device looks like an extra long tampon with a light at the end and can scan the cervix with better clarity than the standard colposcope. Tacrolimus extended release was approved by FDA in 2015 and has already been used in more than 90% of the transplant centers in the US. Now FDA has approved tacrolimus for de novo use in kidney transplantation. This approval was based on a randomized double-blind, double-dummy trial which included 543 de novo kidney transplant patients. US FDA has recently approved the drug Olaparib to maintain the treatment of adult patients with BRCA-mutated advanced ovarian cancer. The approval was based on positive results from the Phase 3 trial. This drug reduced the risk of disease progression or death by 70% in patients who were in complete or partial response to platinum-based chemotherapy. The US FDA has recently approved pembrolizumab for patients with recurrent locally advanced or metastatic Merkel cell carcinoma. The trial results showed an overall response rate of 56% and a complete response rate of 24% in patients who did not previously receive any systemic therapy. The state-of-the-art National Cancer Institute at AIIMS Jhajjar has opened its OPD services for patients. The hospital is expected to be fully functional by December 2020. X-ray facilities, CT scans, and radiotherapy equipment will be operational in the coming 3-4 months. In the initial phase, 5 to 6 doctors will run the 17 OPDs. Researchers from Massachusetts Institute of Technology in the US have recently developed an ingestible capsule that can deliver drugs and monitor health. This capsule is controlled using Bluetooth wireless technology. The capsule can reside in the stomach for almost a month and transmit information and respond to instructions from a user's smartphone. Metformin is the most prescribed anti-diabetic drug in patients with type 2 diabetes. However, long-term use of metformin has been associated with vitamin B12 deficiency, which can lead to peripheral neuropathy. Let's get more insights from Dr. G. Shanmugasundar on metformin-induced vitamin B12 deficiency.
Hey friends, I am Dr. G. Shanmugasundar, consultant endocrinologist practicing at Magna Clinic, Chennai. So we all know that diabetes is on the rise in our country, and we are seeing a lot of young type 2 diabetes patients nowadays. And metformin is the basic therapy, the first line therapy we are using, and we are going to use this. It's an excellent molecule, but the sad part is it can lead to B12 deficiency. We know that in diabetes it can lead to peripheral neuropathy. So B12 deficiency also can lead to peripheral neuropathy. So it's a dreadful combination.
Thank you, Dr. Shanmugasundar, for the invaluable information. We urge our community to share their views by commenting below. These were the latest happenings in the medical field brought to you by Docplexus. one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!